It's an honor and pleasure to host all of you today. We annually do this program, which you can see the subtitle is Maintaining Mental Health. Our first installment of this program occurred a year ago, and now we're revisiting this topic. A year ago, we talked about very general points concerning mental health, and today what we're going to do instead is we're going to focus on a very, very particular spectrum of conditions, which is depression and the blues. So we're going to walk through some basics about the definition of what is depression, what are the blues, what are some of the signs and symptoms that people have when they experience this, how common is it, and then that's going to be maybe the first 1/3 of the program, and then the rest of the program is going to be focused on 11 action points that everyone in this room can take to help both maintain the health, mental health that Allah subhanahu wa ta'ala has bestowed upon us, and also these same points are the common points that are used to help to alleviate the condition if a person feels that they're experiencing either the blues or some degree of depression. We'll also talk about what that means. Do I feel like I have these signs and symptoms? Am I experiencing this? We're going to talk about that as well. Given the very technical nature of this particular topic, we're very, very blessed to have with us Dr. Jawad Pervez, who is a trained and practicing psychiatrist. He, alhamdulillah, completed his medical school here in Chicago. He's actually raised in Chicago, born in Saudi Arabia, raised in Chicago, and completed his medical school in Chicagoland, and eventually went on to do residency and fellowship at Loyola University in psychiatry. And now he's a practicing physician in the Advocate health system in this sphere of psychiatry. So he literally deals with this day in and day out. And I'm here not because this is my specialty, but hopefully to be able to facilitate the questions, to facilitate the discussion, and to also maybe on occasion throw in a little bit of a spiritual twist to some of the material that's going to be covered. So inshallah, on behalf of myself and all of us present here, we have many, many more people present online than we do have in person today. But on behalf of all of us, I just wanted to thank you, Jawad, for joining us today.
Thank you for having me, Shaykh Husain. And honestly, I'm just very happy to be here to discuss a topic that I think is very important and certainly relevant in this day and age, and for our community. So I'm happy to be here. Thank you for having me.
Alhamdulillah. So the topic is, like we've said already, depression and the blues. But I think the first thing is to just understand what is the sort of meaning of what we're talking about. What is the specifics? Because we all know that these terms can be thrown around very loosely. So for example, my flight got canceled, I'm so depressed. Right? You hear this. This is a very common way to use the term. Or, man, I'm going through the blues, my team didn't make it to the Super Bowl. So those are very common ways by which we express, an idea or a feeling that we have. But in this particular discussion, as I mentioned, we're going to be a little more specific. We're a little more technical. We really want to speak about a condition which is called depression and a condition which is called, not technically the blues, but which is often a term that we use, clinically. And so maybe I'll just start by saying, Jawad, what is it? What is this, specifically? How do we differentiate between the sadness that we experience as part of normal life and depression and the blues?
Yeah, I think, the first thing that comes to mind when you say sadness, sadness, is an emotion, it's a mood state. So we all experience different emotions, right? Some of us, we have different mood states. We can be in a state of being happy, a state of being sad, a state of being anxious, excited, surprised, apprehensive, frustrated, right? So we all experience these different emotions at different points in our lives. So everyone in this room at some point or another has experienced a sad feeling, right? Feeling sad. And like Shaykh Husain mentioned, Yeah, you miss a flight, travel plans get canceled, you can feel sad. You get a low test score, you can feel sad. You have a poor evaluation at work, you can also feel down, or you come late to Sacred Learning and you miss the parking lot and you have to walk 2 blocks to get here. So that can make you sad, right, temporarily. So it's a natural reaction to everyday life events. So all of us feel sadness, but to varying degrees. So you might feel a little sad, like for the examples we just gave above, you miss a flight, or you get a poor evaluation, or you get a bad test score. But sometimes we might even feel a stronger degree of sadness. And that could be like, for example, if you lose a job, may Allah protect us. So it's not an on and off switch, right? So sadness is not like you're just going along one day and all of a sudden, boom, you feel sad. Sometimes it can gradually come on, and sometimes it can gradually come off, depending on what may be going on in your life. Another thing to note is that sadness fades over time, right? And alhamdulillah for that. Allah subhanahu wa ta'ala has blessed us with the ability to be able to move past these things. So something happens, a stressor occurs, you get a bad test score, whatever the case is, eventually you can overcome that. And the last thing I'll say on this is that when you're defining sadness, sadness is a situation in which daily activities still continue. So you're able to function at work, you're able to function at home, you're able to function in your family, in your interpersonal relationships. So that's what I would define as sadness, Shaykh Husain.
Okay, so just listening to you speak, I think, subhanAllah, we have examples of this both in the Quran and the Sunnah. So essentially, what I'm hearing you, Jawad, you can correct me, but I'm just hearing you say that, so to start with, we have this emotion of sadness, and all of us experience this.
Right.
And in fact, as you're speaking, we have one example in the Quran where Maryam alayhi salam was really feeling emotionally stressed at the time of her delivery. And she says, Ya laytani mittu qabla hadha. Woe to me, would that I have died before this. Now that's a very, very strong statement. It's an expression of a deep emotion. Or another example would be when the Prophet ﷺ was holding his son Ibrahim, and he began to weep as Ibrahim was passing away. And when the Prophet ﷺ began to weep, one of the companions said, even you, Ya Rasulullah, meaning even you would weep in such a circumstance. Like, it was very amazing for a companion to see that the Prophet of God, subhanAllah, is actually weeping at the time that his son is passing away. But the Prophet ﷺ explained that that this is a rahmah. Literally, the word in the hadith that this is a rahmah, this is a mercy. And when you think about that, it's a mercy from 2 ways. Number one, it's a mercy that we have the ability to undergo emotions. That's what makes life life. You need a little bit. You don't know what's spicy until you eat something plain, right? So that's the beauty of life, that you experience emotions, because with sadness also comes happiness. Everything has a balance. Allah has created everything in pairs. But also, it's good that we have a means of expressing those emotions. Because imagine if there wasn't the ability to cry in a difficult situation, that would all be locked up inside of us, and we would have to carry that. So all of this is part of, I guess the summary is, all of this is part of normal, so long as it doesn't paralyze us or pin us down or take us away from what we normally do.
Yeah, absolutely. It's adaptive. It allows us to function in the world, allows us to experience emotions and therefore react to our environment. So definitely.
Okay, so if that's sadness, then how are we going to define depression?
Yep. So sadness is an emotion. So I want you guys to see this here. So sadness is an emotion versus depression could be classified as a condition, right? Or in other words, you might call it a disorder. And so two ways to look at it, right? One is a natural emotion. One is a condition that not everyone will experience, right? One that everyone will experience. Sadness, we talked about how it's a natural reaction to life stressors. So depression can be that, okay? It can be that. However, depression can also be due to some genetic factors, right? Your family history may dictate that you may develop depression at some point, and that might be due to your predisposition, whatever genes that you are born with. We talked about sadness. It can be in varying degrees. So can depression, right? Depression, once you meet the threshold. So what I talk about threshold is, if you imagine the spectrum right here, and over here you have someone who's feeling normal and healthy. In the middle here you have sadness. Here you have depression. So the threshold is right around this point. Okay, so once you cross from left to right, You cross this point, now you've crossed into the threshold, which puts you in the category of depression. So there are varying degrees even within depression as a disorder or a condition. So you can be mildly depressed or severely depressed or moderately depressed. So we talked about that threshold. Now, one more thing about emotion, we talked about sadness. Sadness can fade over time. Depression can be long-standing, right? So we're not talking a few days, right? Emotions like sadness can last 1, 2, 3, 5 days, but depression will last longer, okay? Maybe weeks. And then last but not least, we're going to talk about sadness we talked about how daily activities can still continue when you're sad. When you hit, when you cross that threshold into depression, this can start interfering with your daily activities. And what do I mean by daily activities? So performance in the workplace, right? Performance at school, right? Your ability to manage your relationships at home or even outside the home. So when those start to deteriorate, then you might be looking at depression.
All right. So essentially, maybe the summary here is that it's just a very extreme sadness.
Yeah.
Right? Which which you can't shake, which lasts for a long period of time, and which a telltale sign is that you see it interfering, or others may see it interfering in your routine. You're not able to get up for work. You're not able to engage in the things that you normally engage. You don't enjoy the things that you normally enjoy.
Right, exactly.
All right. And then in addition, with that general sort of understanding, there's some more specific signs and symptoms which, we're always taught, and I'm sure you regularly are interacting with. So maybe we'll jump into that, the different signs and symptoms.
Right, exactly. So this is to give a clear idea of what depression looks like. So in addition to feeling depressed, sad, down, those are there. Now these are symptoms outside of that, which I'm going to highlight. So there could be changes in sleeping patterns. So you might sometimes sleep less, but you also may oversleep. Right? So sometimes we can see both. Sometimes you'll find people who are unable to wake up. Sometimes you find people who are unable to fall asleep. You can lose interest in doing things you normally would do for fun. So things that you normally would enjoy, they no longer have interest for you. Guilt, this is interesting. You can feel guilt when you become depressed about things you've done or things you haven't done, right? And you might start thinking and ruminating about the past, about what did I do wrong here? What did I do right here? How come this didn't work out? This is my fault, so on. Decreased energy, that speaks for itself. Difficulty concentrating, this can reflect and show up in the workplace, in school. It can show up in your household daily activities, your chores, things that you have to get done. You may not be able to put things together in order to take the next step, right? So you might find difficulty with your memory, your short-term memory, for example. Changes in appetite, again, similar to sleep, you can sleep more, you can eat more, or sometimes you can have a no appetite. And you can see both types of both situations in the depressive situation. Also irritability, what I mean by this is that you're just more easily triggered, right? Things get to you more quicker. So you may be unable to control your anger at certain points that you used to be able to. Last but not least, I'll mention this, physical symptoms. This is more in the adolescent population, but if you start noticing frequent non-specific headaches, stomach aches, things like that. You see this more in the adolescent population. However, this can be present in depression.
So if a person is experiencing some of these symptoms, how is there a person has to experience all of these to technically be depression, or is it a mix of these symptoms, or they exist in every person? And can I just look at this list and say, I think I have many of these symptoms?
Yeah, so it would be a little bit, I'd be wary of looking at these lists and start looking, so taking your pencil and paper pad out and okay, I have this. Don't do that, right? We're not trying to diagnose ourselves here. This is just a general outline. The job of your doctor is to understand and figure out, okay, is this something that meets, remember we talked about that threshold. Does it cross that threshold? So what I would say is not for us to worry about, how many of these we have, what number, how many days, how many weeks, but just to understand that these are some things to look out for, like Shaykh said, in ourselves and in others.
Now, I'll just tell you. So, I'm a professor at a university. So, and it's in the medical school. So, the medical students are very stressed. And the residents are very stressed, and the attendings are very stressed. So we're in a high-stress environment. Everybody lives in a high-stress environment. I don't want to say that I'm in the only high-stress environment, but they give us training. And what is that training? That training is to watch out for signs and symptoms in ourselves. And just as important, which I really want to impress on everybody here, is that we have to also watch out in these signs and symptoms in everybody around us, particularly when we have a close relationship with them, because it's very prevalent, as we're going to talk about in a moment. And when I'm training the residents and the medical students and similar people, I'm one of the people that really engages with them one-on-one. I know that this person came in, usually someone will come in and work with me for 3 or 4 years, not with me only, but with our group. And I know them from day one, and I know them along the way. And so part of the responsibility that I have as a teacher for these individuals is to keep my finger on their pulse, on their mental health pulse, and to be able to ask the question, wait a minute, you're not the same person that I remember you to be 5 months ago, and to simply just ask the question, is everything okay? Now, subhanAllah, we have that responsibility in the masjid, we have that responsibility at work, we have that responsibility in our families. So this is something that we have to appreciate as possible within ourselves. It's common and possible anywhere along our life. We'll talk more about that in a minute. But also we have to keep the pulse on our family and loved ones and people that we have close relationships with, and be able to recognize when something's off so that we can advise people and help them. Because remember, I'll tell you, the hospital where I work, and I'm sure, Jawad, you have the same mental health and wellness nowadays.
Yep.
They're very invested in this. They bring in high quality speakers. They have weeks and weeks that they dedicate to what they call resiliency training. And why are they so interested? Because if people are not kept in a certain level of wellness, then they're not going to be able to function well. The organization's not going to thrive. So we as an ummah are the same way, meaning the Prophet ﷺ in general, and then this is more specific. We have advices that help us as an ummah to be able to maintain the blessings that Allah has bestowed upon us, including our health, our wellness, our deen, right? Our relationship with Him. And we need to understand that even the preservation of these things is really important.
Yeah, and I just add that, a lot of people that come to my office, they're not coming necessarily because they themselves said, hey, I need to get help, right? It happens. But a fair amount of, a good majority of the folks, I would say, come in because someone recognized it, right? Their spouse, their sibling, their family member, their primary care doctor, whoever it is. So like Shaykh Husain mentioned, this is absolutely vital that we look out for this in others, and especially those we are close to.
All right, so, one of the reasons we chose this topic, like I mentioned last year, we talked about mental health and wellness in general. And then this year, what happened was at the university, they required all of us to do this training, which was this training on common mental health issues that are arising in students and at every level of the university. This was a big university-wide initiative, not just for the hospital, but all of the university. And when they showed the data, my jaw dropped. I just underappreciated just how common. I know it's there. I know even, we all experience it to some degree or another. But the numbers they presented to me was just really eye-opening. And I began to realize that it's even far more prevalent and common than I myself, had necessarily appreciated before that. So, I just took this piece of data. This isn't from the university. This is more general. But, we'll just focus on this very initial middle box. I've boxed in this middle piece of data. So the yellow is, okay, this box represents the prevalence of anxiety, or in this case, depressive type conditions. It's the spectrum of depressive type conditions. And notice that there's 3 colors, yellow, red, and purple. And the yellow indicates January to June 2019. So what is that? That's pre-COVID, right? The red is May 14th to 19th, 2020. That's just when COVID became, we were in the middle of lockdown. Let's put it that way. The whole world was literally in the middle of lockdown. And then December, 9th to 21st, 2020 is when the vaccines were announced. And we were sort of like starting to come up with some additional hope. We didn't recognize we were going to hit some speed bumps along the way, but there was a lot of, potential hope. And look at these numbers, just, 6% to 24% to 30%. Now, these numbers are informing us of 2 things. Number 1, the prevalence. I should say 3. Number 1, the prevalence. Number 2, how important it is for us to watch out for it. And number 3, there's a little hint here in this data about what can lead to this. right? The fact that you isolate human beings who are social creatures and stick them in a place where they can't leave, and then they're also constantly worried about what could happen to them while they're in that place, that's not a very good mix for us. None of us do well in that mix, particularly when we're taken out of the environments that allow us to engage with others, like the masjid, school, work, the community centers, etc. So you can just look at those numbers, how rapidly this just it increased throughout the general population. So it is something. We're all human beings. There's not anything here to say like to be ashamed of or to look down on. We're all human beings. If you stress us to a certain extent, we're all going to reveal our own tendencies. Like Jawad mentioned about the genetics and the environment. We're all human beings. We have genetic propensities. All of us do. They differ, but they're all present within us. And if you stress any one of us to a certain extreme, we're all going to face and grapple with some of the conditions that we've discussed earlier. At least some of the signs and symptoms. At some degree or another, there's a spectrum. All right. So with that background, now I said to you at the very beginning, or mentioned at the very beginning, that really the goal here is I wanted to be practical. I didn't want to give like a medical lecture. We wanted to just give very, very, very tangible things that I can do, that Jawad feels that he can do, that he recommends to his patients, and that professionals are recommending to others. So normally people will do this in tens, top 10 things you can do, but we're Muslim, we do odds. So it was between 9 and 11. So, I said, let's just go with 11 because we couldn't narrow it down to 9. And we thought, inshallah, we'd be able to fit it in the time span that we have remaining. So, we tried to time this as well. We want to respect everybody's time here. And we also know that you can only you can only absorb so much in any one sitting. So we're going to give 11. 11 hard, very tangible, firm pieces of advice that all of us can implement in our lives wherever we are on the spectrum. We may not be experiencing anything today, but at least these things will help to strengthen us to avoid it and to decrease the incidence in the future. Or we may be experiencing some of this to some degree or another, and we'll mention different things that can be done, all of these things would be relevant to every person in this room. Okay? So that's the goal.
Yeah, and I think we talked about how, going back to that spectrum, what these things will do, these 11 items, the idea here is that wherever you are on the spectrum, right, whether you're normal, feeling good, whether you're experiencing sadness, whether you're getting closer to depression or you've already crossed that threshold and you're depressed, the idea is that these 11 items will push you in this direction, push you in the direction towards health, right? So it doesn't matter where you are on the spectrum, you can use these. So that was the point I wanted to highlight.
All right, so action item number 1. Action item number 1 is to always keep things in perspective. Now, what do I mean by that? So we as human beings, we get very caught up in our own world. We as human beings get very caught up in our own world. So my tendency is to get very excited and worried and concerned about what's immediately happening in my circle without necessarily seeing the bigger picture of what's going on. It's just human nature. It's human nature to get very, very caught up in what's happening in my universe and to forget that I'm in a much bigger picture. I'm in a much bigger universe. Or otherwise stated, we get hyper-focused on the pixel and we lose sight of the whole picture. So one of the things that we need to do, or that is a common piece of advice, is to shift our perspective. So let's say it this way. Part of sadness and depression is that the perspective changes. I'm not able to do anything. Everything seems to be wrong. Nothing is going my way. Why does this have to be that way? So that's a perspective shift, right? The person's seeing things from another perspective. So one general principle is to always keep things in perspective. The first sort of action item here is to always remember that our core worth comes from Allah subhanahu wa ta'ala, not from others. So what that means is that you have to understand, once a person enters Iman, now of course I'm addressing Muslims here, so it's a little bit of a unique opportunity, but once a person enters Iman, they have won the spiritual lottery. They have won the spiritual lottery. It is such a big blessing to have iman, to be able to take the name of Allah on our tongue, to be able to even bow to Him for a moment, to be able to even say subhanallah. It is such a big blessing that everything else just pales in comparison. Like, hey, my car broke down. Who cares? Like, car? What are you talking about? I have iman, I have Allah, I get the chance to pray, I can say subhanallah, I can breathe air, I can see light. It's a small thing. So to just shift the perspective to recognize that we have already been blessed with such an enormous gift. And this gift is so big that when you look at anything else, it should completely reset the perspective. Now, this can be summarized, this whole point can be summarized in one statement of the Prophet ﷺ. And I just want everyone to just think about it for a moment. The Prophet ﷺ, he said, Ajaban li amril mu'min. Wondrous is the affair of the believer. The Prophet ﷺ said, wondrous is the affair of the believer. Why? Because every single circumstance for them is good. Every single circumstance for them is good, meaning it's all good. You know, like sometimes something happens and you're like, it's good, man. It's good. The affair of the believer, it's all good. Why? Because if a difficulty arises, they're patient and they get a reward. It's good for them. And if a blessing arises, they're thankful and they get a reward. So what that means is that every circumstance should always be seen as good. It's always in my favor. There's always a good here. There's always a benefit. No matter how difficult, sad, hard it may be, there's good in this. I just can't see the bigger picture. I need to leave my pixel and I need to see the picture. So this would be, the action item 1, which would be to recognize that worth comes from Allah, that Allah has blessed us and given us tremendous worth, and then to see beyond what is apparent. To not necessarily make immediate judgments or react based on what's immediately happening to me, but to see the bigger picture that Allah subhanahu wa ta'ala has a blessing for me in this. There is good in this. Maybe I can't see it today.
Yeah, and to add to that, from a psychological perspective, right, our sense of self-worth, our self-esteem, of course, is going to come from people around us, people who validate us in our environment, right? Immediate family, friends, so on. But when you shift that and you make the overarching principle that Allah subhanahu wa ta'ala is the one that's going to give me worth, simply because I was born into this ummah, then what happens is that your sense of worth, your self-esteem becomes a protective layer against depression. We talked about things that stem, I was talking earlier about these 11 action points. They can stem the tide. You're pushing the tide this way when you enact these things. And inshallah, you can stem the tide when you start thinking to yourself, well, my worth comes from Allah subhanahu wa ta'ala. I was born into this ummah. And I can tell you from a psychological perspective, and I see this in the office all the time, that if someone walks in with a very strong sense of self-worth and self-esteem, their ability to fight that depression is much stronger. Right? It's like having a protective layer around you. I don't know what superhero you guys, what give me Iron Man or something, I don't know. Protective layer, something strong, right, around you. And it's a protective mechanism. And I think that I'm really glad that Shaykh Husain mentioned this point because self-esteem and self-worth is not talked about enough in our communities. Okay, so yeah, we can go ahead and get started here. This is item number 2. So we just talked about perspective. Now, this is about daily goals. So we should all have daily goals that we want to get accomplished in a given day. So each goal you accomplish leads to a dopamine release or endorphin release. What I mean by that is that's a feel-good hormone, okay? Put it that way. So each goal you accomplish leads to a release of that dopamine or endorphin, which is a feel-good hormone. This in turn leads to a improved mood and you have a better sense of less depression, more happiness. So what I tell people in the office is that let's say that your mental energy, your mental battery is low, okay? Each time you accomplish a goal, it's like charging your mental battery, okay? It's like plugging your phone into the outlet for 10 minutes. So the more goals you check off the task list, the better you feel, and the more you can keep your phone plugged in, eventually until you're powered up to 100, and your battery is full. So the analogy is that each goal you accomplish during each day is like plugging the phone into the outlet and charging the battery. So, and it goes without saying that our dini obligations of the fara'id, like the salah, is built into our day anyhow to serve as battery chargers for us, correct? So that's why there's a multi-million-dollar industry, right, centered around building apps that allow us to track our tasks. Why is that? Because we know that each time we click that box, it's oddly satisfying. I mean, to me, it's really satisfying. Maybe the only thing more satisfying than that is a daytime nap. And maybe I can put that into my daily goals too, incorporate that. Recurring daily task, daily nap, Kailula. So now that we know what goals can do for us, right, we can discuss the different types of goals that are important for us too, that are shown in the literature, psychology literature, that are effective, that we should be setting for ourselves. So the first one is a SMART goal. I'm gonna give you an example to explain this. If I tell Zaid, let me see, maybe my son is probably better, but fine. I'll keep it as Zaid. Zaid, go clean the kitchen. Okay, so that's a very generic goal, right? Hey, go clean the kitchen. It's generic, it doesn't give him too much direction. He comes back to you, he wipes the countertop and says, I cleaned the kitchen, right? Versus if I say to Zaid, okay, Zaid, wipe the countertop every Monday by 10 p.m., mop the floor every Tuesday by 11, and do the dishes every day by 8 p.m. What's the difference there? I'm turning that generic goal into a SMART goal. And a SMART goal is specific, measurable, it's attainable. So specific in this sense, I told Zaid exactly what to do, right? It's measurable. I can go back and say, is the countertop clean or not, right? Is the floor mopped or not? It's a yes or no answer. It can be measured, right? It's actionable, meaning he can actually do it, right? It's reproducible, something he can do regularly, and it's time-bound, meaning I told him by a specific time he should do this. Now, why am I bringing all this up? Because for our own selves, it's better to have SMART goals in our lives than just generic goals. You set a generic goal, you're unlikely to meet that. You have a SMART goal, for example, for myself, I say, okay, you know what, this week I'm gonna clean out the garage. Well, that sounds like really overwhelming, right? It's gonna clean out the garage, right? That's great, good plan, right? But instead, I make that a SMART goal, and I break it down, and say, okay, I'm gonna clean out the storage bins, I'm gonna sweep the floor, I'm gonna organize the wall shelves, right? I'm gonna sort through the suitcases of old Desi clothes, right? We all have those. So the idea is you take the larger task and you make it a SMART goal, and then you can subsequently check that off your list, right? Whether it be take you a day, a weekend, or whatever. So you check off the list, you get the endorphin release, right? We talked about endorphin release. So SMART goals lead to what is a productivity task. When you have a SMART goal, it naturally leads to productivity. So one example Shaykh has given in the past, where you get up in the morning and you make your bed, right? So you make your bed every morning, because what happens after you've done that, you feel productive, right? So that's pretty straightforward. Now there's something called mastery tasks, and I just want us to kind of think about this. Mastery tasks are a task in which a person can hone in on a particular skill set and develop their skill like in that skill. So for example, woodworking, sewing, knitting, painting, bike riding, cooking. I have no mastery in cooking, but I can inshallah one day. So the idea is to find tasks that are enjoyable and in which you can build mastery. Right? Enjoyable plus in which you can build mastery, because the literature shows that these kind of tasks elevate our moods and they can serve as healthy coping skills for us. Okay? So we just mentioned those kind of tasks, right? Woodworking, sewing, knitting, painting, bike riding, cooking. There are tasks that are enjoyable, but there may be no mastery involved. These kind of tasks are shown in literature not to be so good for us. For example, playing Candy Crush, right? Okay? Now look, it's fine. It's enjoyable, I guess. I don't know. It's enjoyable. But I don't know how much mastery you can achieve in that. And some would argue with me like, oh, it's very, very meticulous, Fine. But it's not really you're achieving mastery there. So those kind of tasks are actually unhealthy for us. Okay? Just I wanted to kind of highlight that point. And that's pretty much it for this one.
Yeah, by the way, now you got me off on a tangent here, but, let me just say that these goals are defined. So what that means is I personally would just say make 3 goals. Make 3 goals for yourself. You want to succeed, but you don't want to make it so low, the bar so low that it's not valuable.
Right.
So if you just say to yourself every day that I'm just going to have 3 goals, 3 new goals, or if you have the ability to do it daily or weekly or whatever it is, I'm going to hang that frame that's been sitting on the floor for 6 months, or I'm going to clean out the shoe closet, or I'm going to pick something else. I'm going to take my bike to get the flat tire repaired, that bike that's been sitting around in the garage forever. So these little bits make a person achieve something that, as Jawad mentioned, feeds upon itself and allows a person then to be able to pick up to the next thing and the next thing and the next thing. So the idea here is to string together a series of tasks with goals interspaced in between, which encourage the person towards the series of tasks that they're trying to do. So it's good to keep a series of goals, daily checklist. For Muslims, I mean, we have a dini checklist, right? I mean, there's some things that are fara'id, and then there's some additional things we can add. Hey, I have a goal, 10 minutes of Quran every day. That's a big deal. By the way, 5 minutes of Quran every day is a big deal. So if we just make that a goal, it's very attainable, it's very positive, it is very valuable. You can produce a very high yield in a very small amount of time, and you will feel the difference. You'll feel the difference over time. All right, so the action item number 3 is to take nature walks. Now, this action item actually provides you with 3 benefits. Benefit 1, you move, meaning you get the body moving. Benefit 2, you get to bring in nature, which is the visual green and the ability to take in fresh air and the sounds and all of what comes with nature. And then benefit number 3 would be the idea that you're going to take in tremendous amounts of sunlight while doing this. So these 3 things, each of them independently, for example, walking, number 1 increases epinephrine, norepinephrine, which is shown medically, even historically, to benefit people who are having sadness and depression. If it's enjoyable, you're going to get a dopamine pulse from that as well, which is also going to benefit with depression. The green of nature shown to raise serotonin levels. Serotonin is a neurotransmitter that has been shown to be particularly helpful in people with sadness and depression. And similarly, light raises serotonin and also helps to increase your vitamin D levels, which also can have an effect on mood. So generally speaking, all of these pieces together, I tried to piece them together in something. If, let's say, the recommendation would be twice a week, or maybe you have a more specific one, but twice a week to go someplace green. Not the concrete jungle that we live in. Go someplace green. And all villages, cities, towns, states have these kinds of places. I mean, I know where this is literally all concrete everywhere, but I can tell you 5 minutes from here, there's a nature preserve. Literally this street, maybe if you ever have a chance, just take Pulaski, Crawford down, it becomes Pulaski 5 blocks down on the left-hand side. Maybe it's not 5 blocks, maybe it's about half a mile down or a mile down on the left-hand side. There's the nature center, the nature preserve, and there's a beautiful trail. The whole thing takes no more than 7 minutes to go around, and it's totally green. You won't even know you're in the city. You don't even know you're in the city. It's just very, very nice. And all cities have this type of thing. So 3 benefits are all combined in this, 10, 15, 20 minutes a day, walking, take in nature, take in sunlight, and all of these things literally do so many of the things that some of the medications that we use, that Jawad probably uses for sadness and depression. You have many of the same effects. Not that these can replace that, but you have many of the same effects.
Yeah, and it reminds me of there's a study in Stanford they did where they had people walk through a lush green section of the campus, and then they measured their happiness afterwards, and they had another group of people walk through a street that was nearby traffic, and you can guess which group was happier and more attentive afterwards. Again, it's proven, and I know Shaykh Husain already mentioned it, so all the benefits are there. So the next item here we're talking about here is volunteering or being active. So look, volunteering helps you to carve out your identity. Okay? So for example, I say, quote, Zaid always gets picked on, but Zaid is heavily involved in food kitchens, right? I make that statement about Zaid. So now anyone who hears that statement, or if Zaid hears that statement, or his family members, they know that that's his identity, right? Mashallah, he's a practicing young boy, but he also helps out in the soup kitchens. So that's sort of part of his psychological being. So having a formed identity within your Muslim community portends improved mood. Okay, so basically what I'm saying here is that the literature says that, hey, if you have an identity and you can stand by that identity, you're much more likely to feel improved self-worth and therefore mood. So, quote, for example, Zainab is known for her work with orphans. So she gets classified in that realm. So when Zainab or Zaid look at themselves in the mirror, they say, okay, what is my identity? Well, I'm a practicing Muslim, student. I'm a practicing Muslim father of 2 who's actively involved in helping the hungry. Now, if you have that kind of identity built into your core, it only follows that certain behaviors arise out of that, right? When you say to yourself, I am this kind of person, right? Then what does that mean? I'm going to do this kind of behavior, right? If I'm a certain kind of superhero, I have certain types of powers, right? So when you have an identity, that portends what you're going to do. It lets us know, okay, where are you going to be? What kind of behaviors are you going to be involved in? It's good psychologically to have a niche, right? To identify yourself in something. It doesn't have to be a huge role. It doesn't have to be a public role for that matter. You could be the guy that cleans the bathroom in the masjid. But you have a role, and you understand your own role, right? And it doesn't have to be that everyone knows about it. You don't have to post about it on Facebook, right? You do it, but you feel good that I am doing this. This is my identity. And we talk about raising self-esteem. That's a given. You help other people. This has been shown, replicated in studies over and over again. You help others, you feel better about yourself, right? We've seen this in the Sunnah as well, of course. And another thing is that you can get a lot of modeling can happen here. Modeling meaning that you model behavior, right? So if my son or my daughter is going to these volunteer activities, then they can actually see their other same age peers doing good things, getting involved in the community, and that allows us to get energized as well. So there's been many studies, and I'm not going to quote them or anything, but there are studies that show that over time, volunteering has a very good impact on psychological well-being and self-reported health.
So these two things, this idea of making a task list and also this idea of being active and volunteering, the way I kind of piece all these together is that there's this theory called the flow theory of happiness. Flow theory of happiness. Essentially what the flow theory of happiness says is that when you consistently are doing something in small pieces that you enjoy and you're flowing through and you're actually, clearly being able to show that you move from A to B to C, that maintains happiness. Whereas if you overload someone and they're not able to flow through their routine because they have too much stress or too much work on them, or they have unattainable goals, you paralyze them in that it's almost like a quagmire, and they're not able to then flow, and that happiness is not achieved. So we always want to balance ourselves. We don't want so much pressure that we're doing 100 things and nothing ever gets done well, and people are complaining, my family's complaining, my work is complaining, I'm never at work, my family's complaining, I'm never at home. We want to make sure it's balanced. And be content with it. Because look, Allah subhanahu wa ta'ala, we don't, why do we do this? We do it for Allah. And if we're doing it for Allah, we don't have to do A, B, or C amount. Allah judges us based on our intention, not based on what we achieve. So I don't need to be the scholar in the masjid. I don't need to be the president of the board. I literally could be the one who in the middle of the night came and swept the sidewalk on a snowy day, and Allah possibly would even reward that person more than the president of the board. So again, we should leverage the fact that Allah subhanahu wa ta'ala is so merciful and so rewarding and so accepting and sees all, hears all, knows all, captures all. It really should make us confident in being able to be part of something bigger than ourselves, which raises us, in who we are.
Yeah, so this brings us to our next point, sleep hygiene. So basically the idea here is that when we talk about sleep hygiene is how to put sleep in the center of your life, but do it the right way. Right? Sometimes we can sleep. Our patterns of sleep are not healthy. So we're going to talk about some of those things. So one thing is that they talk about wind down routine. A wind down routine is a series of activities, maybe 2 or 3 things that you do every night, right, before you go to sleep. So the idea here about sleep hygiene is to improve your overall quality of sleep. So if you do these 3 things, for example, you read Surah Mulk, you make wudu, right, and then you get into bed, right, you wear your favorite jammies, right. So what happens is it's like Pavlov's dog, right? If you guys remember this, but the bell rings. You show dog food, bell rings. All of a sudden, now when the bell rings, he's salivating without any sight of food. What happens is the body starts to associate. Okay, for the last 60 days, the person's read Surah Mulk, they're making wudu, they're putting their favorite jammies on, they're about to go to sleep. The body starts to associate making wudu, making the putting your favorite jammies on. That becomes associated with sleep, right? So. And another thing, just to highlight this point, we also want to avoid associating our bed with other activities. Same thing, because our body starts to associate these other activities with staying awake. For example, using our laptop in the bedroom, on the bed, right? Or maybe browsing on our phone on the bed. So what happens is your body starts to say, hey, wait, the bed is not meant for sleep, it's meant for arousal. I'm meant to be awake. I'm meant to be, looking and observing and reading. So that's the same situation where we want to avoid those kind of negative associations. Caffeine, this is a very simple solution. We got to reduce our caffeine. I know, mashallah, we have a lot of chai drinkers in here probably. But look, caffeine can cause difficulty in all arenas in the psychiatric world, right? So we can have difficulty with sleeping, and it can cause anxiety. It can lead to exhaustion when you withdraw from caffeine. It can make you irritable. It can be a host of other symptoms. So the general rule of thumb is less than 60 milligrams a day. If you're approaching over 250 milligrams a day, that's a problem. You can come talk to me afterwards, okay? But to reduce the Starbucks. So avoid blue light, very simple. Avoid blue lights. Blue light decreases melatonin. Melatonin is a hormone that we need that allows us to sleep. So avoid big meals at night. Midnight snack is okay. Midnight biryani or khichdi is not, right? So nighttime snacks, the foods that promote sleep. I wanted to quickly do this because I want you guys to understand maybe there's some things that we can start incorporating into our routine. These snacks increase melatonin release and also provide us with other essential nutrients that help with sleep. So honey, oatmeal, kale, right? Hummus, believe it or not, provides you with melatonin and also another amino acid. Almonds, walnuts, pistachios all have naturally occurring melatonin. Pineapple boosts melatonin production. Kiwi, watermelon also has natural antioxidants and is known to help with sleep. Unfortunately, mangoes are not on here. But and then also routine helps, routine and sleep. So sleeping at the same time, waking up at the same time. Trying to be consistent. I mean, look, don't overwhelm yourself and, okay, weekends you're going to have some leeway. But ideally trying to be in a window of time. I'm going to sleep at this time, I'm going to wake up at this time. That's why it's supported by the Sunnah as well. Also, darker and colder rooms if tolerated. Some of us have difficulty with these temperatures, that's fine. But studies have shown that's helpful. Last but not least, sleep on your right side. We know this is from the Sunnah, and from the studies we know that it increases a certain type of activity in our body that helps us sleep.
So one thing I'll just say about sleep is that to understand why are we even talking about sleep? What does sleep matter, in the context of mood issues? And I think it's important to remember that what happens is throughout the day, we absorb all of this world. We hear things, we see things, we do things, we're bringing in all of this. Now, what happens when we sleep is when we sleep, it's almost like the landscaper comes in. Your sleep, while you're sleeping, these slow waves and fast waves are crossing over your brain. It trims this and gets rid of it. It fertilizes this and holds on to it. It helps to clean up the jungle, the jungle of ideas that's present in our mind. Put it that way. Everything sort of gets fertilized, everything gets trimmed and cut back and properly arranged. So you experience the world, sleep, and reset. Experience the world, sleep, and reset, and then you produce an organized sort of pattern in your mind. But if it's chaos, coming in, and then the sleep's not proper, and the next day more chaos coming in, and then the sleep's not proper, and the next day more chaos coming in, the sleep's not proper, you can see very quickly it's going to turn into this sort of like completely overgrown, out of control jungle in our minds. And that is very hard to untangle. So sleep is very important. And subhanAllah, sleep is something that our deen tells us about. وَجَعَلْنَا نَوْمَكُمْ سُبَاتًا. It's in the Quran. Allah subhanahu wa ta'ala says that, and we made your sleep as a respite for you, as a time when you can tune down and reset. So sleep is very important, and that's why we've mentioned it here. All right, the next action item, and we have about, I think, 10, 15 minutes left. We may go a few minutes over, but, we're coming to the end here. So the next action item is to fast from the media whenever possible. To fast from the media whenever possible. Now, why? What's the importance? Well, there's many, we could literally have a 1 hour conversation, more than 1 hour conversation on this topic. But I'll just say two things. Number one, media, social media in particular here, what we're referring to, and these types of engagements, they provide constant stimulation. All right, now let me just explain something, which is that human beings are designed, the biology of human beings so far, according to our understanding, which was also hinted at by Jawad, is that we are designed to take a little bit of pleasure. When we have pleasure, we get what's called a dopamine hit. Dopamine is just a neurotransmitter, okay? We get a dopamine hit. And believe it or not, with every bit of pleasure, there's a little bit of pain, subconscious pain. You don't appreciate it, but that's why you feel the pleasure. Your body gives you a hit of pleasure and a subconscious hit of pain. Now what happens, after that, you need to reset. If you get dopamine, 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 the system gets off balance. Now, when we engage with a YouTube video, admittedly, a 10-minute, 15-minute YouTube video interaction could be a positive thing. But if we watch the YouTube video and as soon as we're done, it jumps to the next one, and then jumps to the next one, and then recommends the next one, and then the next one, and then the next one, it's just hit after hit after hit after hit after hit, and we lose balance, and we stop getting the benefit from, when we stop getting, the dopamine decreases with every hit, and so we start feeling empty despite the fact that we're doing something that we used to enjoy. So the whole system becomes completely skewed. The whole pleasure, pain, balance becomes completely skewed. So, there are literally people who become depressed because because of the amount of video games they play, the amount of videos they watch, the amount of time they spend on social media, even though they enjoy it. Like they enjoy video games, they play so much that it actually leads them to sadness and depression. Now, why is that? Again, it's the same principle. The studies show dopamine hit, 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 hit. So you start losing the pleasure, but you feel like you have to keep doing it, and that because you're seeking the pleasure, and it just leads to a very downward spiral. So two things. Number one, whenever you choose to do
painting, bike riding, cooking. There are tasks that are enjoyable, but there may be no mastery involved. These kind of tasks are shown in literature not to be so good for us. For example, playing Candy Crush, right? Okay? Now look, it's fine. It's enjoyable, I guess. I don't know. It's enjoyable. But I don't know how much mastery you can achieve in that. And some would argue with me like, oh, it's very, very meticulous, Fine. But it's not really you're achieving mastery there. So those kind of tasks are actually unhealthy for us. Okay? Just I wanted to kind of highlight that point. And that's pretty much it for this one.
Yeah, by the way, now you got me off on a tangent here, but, so let me just say that these goals are defined. So what that means is I personally would just say make 3 goals. Make 3 goals for yourself. You want to succeed, but you don't want to make it so low, the bar so low that it's not valuable.
Right.
So if you just say to yourself every day that I'm just going to have 3 goals, 3 new goals, or if you have the ability to do it daily or weekly or whatever it is, I'm going to hang that frame that's been sitting on the floor for 6 months, or I'm going to clean out the shoe closet, or I'm going to pick something else. I'm going to take my bike to get the flat tire repaired, that bike that's been sitting around in the garage forever. So these little bits make a person achieve something that, as Jawad mentioned, feeds upon itself and allows a person then to be able to pick up to the next thing and the next thing and the next thing. So the idea here is to string together a series of tasks with goals interspaced in between, which encourage the person towards the series of tasks that they're trying to do. So it's good to keep a series of goals, daily checklist. For Muslims, we have a dini checklist, right? There's some things that are fara'id, and then there's some additional things we can add. Hey, I have a goal, 10 minutes of Quran every day. That's a big deal. By the way, 5 minutes of Quran every day is a big deal. So if we just make that a goal, it's very attainable, it's very positive, it is very valuable. You can produce a very high yield in a very small amount of time, and you will feel the difference. You'll feel the difference over time. All right, so the action item number 3 is to take nature walks. Now this action item actually provides you with 3 benefits. Benefit 1, you move, meaning you get the body moving. Benefit 2, you get to bring in nature, which is the visual green and the ability to take in fresh air and the sounds and all of what comes with nature. And then benefit number 3 would be the idea that you're going to take in tremendous amounts of sunlight. while doing this. So these three things, each of them independently, for example, walking, number one, increases epinephrine, norepinephrine, which is shown medically, even historically, to benefit people who are having sadness and depression. If it's enjoyable, you're going to get a dopamine pulse from that as well, which is also going to benefit with depression. The green of nature shown to raise serotonin levels. Serotonin is a neurotransmitter that has been shown to be particularly helpful in people with sadness and depression. And similarly, light raises serotonin and also helps to increase your vitamin D levels, which also can have an effect on mood. So generally speaking, all of these pieces together, I tried to piece them together in something. If, let's say, the recommendation would be twice a week, or maybe you have a more specific one, but twice a week to go someplace green, not the concrete jungle that we live in. Go someplace green. And you know, all villages, cities, towns, states have these kinds of places. I mean, I know where this is literally all concrete everywhere, but I can tell you 5 minutes from here, there's a nature preserve. Literally this street, maybe if you ever have a chance, just take Pulaski, Crawford down, it becomes Pulaski, 5 blocks down on the left-hand side. Maybe it's not 5 blocks, maybe it's about half a mile down or a mile down on the left-hand side. There's the nature center, the nature preserve, and there's a beautiful trail. The whole thing takes no more than 7 minutes to go around, and it's totally green. You won't even know you're in the city. You don't even know you're in the city. It's just very, very nice. And all cities have this type of thing. So 3 benefits are all combined in this, 10, 15, 20 minutes a day, walking, taking nature, taking sunlight, and all of these things literally do so many of the things that some of the medications that we use, that Jawad probably uses for sadness and depression. You have many of the same effects. Not that these can replace that, but you have many of the same effects.
Yeah, and it reminds me of there's a study in Stanford they did where they had people walk through a lush green section of the campus, and then they measured their happiness afterwards, and they had another group of people walk through a street that was nearby traffic, and you can guess which group was happier and more attentive afterwards. Again, it's proven, and I know Shaykh Husain already mentioned it, so all the benefits are there. So the next item here we're talking about here is volunteering or being active. So look, volunteering helps you to carve out your identity.
And that we used to enjoy. So the whole system becomes completely skewed. The whole pleasure, pain, balance becomes completely skewed. So, there are literally people who become depressed because because of the amount of video games they play, the amount of videos they watch, the amount of time they spend on social media, even though they enjoy it. Like they enjoy video games, they play so much that it actually leads them to sadness and depression. Now, why is that? Again, it's the same principle. The studies show dopamine hit. So you start losing the pleasure, but you feel like you have to keep doing it, and that because you're seeking the pleasure, and it just leads to a very downward spiral. So 2 things. Number 1, whenever you choose to do something in your life, do it in small increments. Yes, okay, if someone enjoys video games, fine. Play for a set period of time, put it away, experience a little bit of withdrawal and boredom, so that the next time you play, you actually enjoy and appreciate it. But if it's hours upon hours, you won't be able to even enjoy it. It just becomes something you just feel like you have to do, but you don't understand why. Subconsciously, you get driven by that. So that's one problem with the constant stimulation of social media. Netflix is the same, Facebook is the same, video games are the same. Even honestly, prayer is the same. Notice that our deen does not let us just pray consistently over and over and over and over again. You have to break the prayer and engage with family. Notice our deen does not permit us to fast every day. You would lose the benefit of fasting if you fasted consistently every single day. The deen tells us, fast a day, break a day, fast a day, break a day. So anything done to excess will cause this same problem, but particularly it exists in social media nowadays. And the second thing is just the negativity. When you're engaging with media, there's so much negativity. It comes in, it totally skews that perspective that we talked about. It looks like everything bad is happening in the world. It looks like nothing good. There's no happiness. It's every negative upon negative thing. The whole world gets painted with a dark paintbrush. So we really want to avoid that as well. And then the third I would add here is we lose our self-esteem. If everybody always takes the perfect picture and posts how they're always smiling and they're always eating luscious foods and they're always happy, when that's not the truth, then we also get a skewed impression of what reality is. So we lose perspective there as well.
Yeah, and I think, shifting over to managed stress. So the analogy we're going to use here is imagine, we talk about having a plate, right? And imagine that your entire bandwidth, your entire ability to handle life stressors is reflected by the size of that plate. So your day-to-day responsibilities are on that plate. You have your job, your children, your dini obligations. But when you get sad or depressed, what can happen is the size of that plate can decrease. And then what happens? Things start to fall off and spill off the side of the plate, right? So we've all heard the expression, I have too much on my plate. Well, the whole purpose of this discussion here is to highlight that we need to reevaluate what we have on our plate, right? When we are experiencing sadness or depression. We have to understand that that plate has shrunk, right? It has less ability to handle certain things. So we may have to, we don't have time, honestly, at that point when the plate is smaller and we already have all these obligations to worry about he said, she said, right? We can't add that to the plate. We don't have the room for that because the sadness and depression has decreased the size of it. Maybe we shouldn't start that side business because our plate has shrunk, right? Or maybe we shouldn't take on the extra community role like Shaykh Husain had mentioned that we have to temper being able to volunteer or not. Maybe we need to downsize our expenses to limit the financial stressors. The point here is, our shuyukh and ulama have the largest size plates. SubhanAllah has given them that burden, they carry that. But we are normal individuals and our plate shrinks, with the degree of emotion that we're feeling. So we need to recognize that, and that's the whole point here, is just to manage our stressors. Be careful what we're putting on that plate.
So here I will say that just recognize, I'll just quote you one study, which is that bouts of intense stress weaken us and expose our propensities, particularly in the case of depression. So for example, normally a person can take 1, 2, 3 bouts of heavy stress in their life. Like let's say a major conflict with someone, a huge loss of something that was really, really dear to you. You can take, human beings are designed to take up to 3 to 5 very, very severe hits in life. But the more the bouts of intense stress, the more likely the person is to experience sadness and depression. All right? So the more the bouts of intense stress, the more likely a person is to experience sadness and depression. In fact, this is even worse with some people who have a genetic predisposition. There's a particular receptor which can increase your risk. I don't want to go into that. But let me just say that, we don't want to fight wars with anyone. Because in war, there's collateral damage, and the collateral damage is me and my mental health. So I'm not here to fight a war with anyone. I am going to let as much go as possible. Because look, life is already going to bring challenges. Why do I want to fight multiple battles with my neighbor? Me and my neighbor fight every day because I'm upset how he puts the garbage can in front of my house. Forget about the garbage can, because maybe I could fight with him and get him to move the garbage can, but now my whole life becomes focused on the garbage can, and it's another stress. How am I going to handle that? So generally speaking, I'll just give you a few pieces of advice, and then I'll give you one hadith, which, will make this easy. They're all on here. Avoid conflict to the best of our ability. Be easygoing. Let things go. They don't matter because the cost is too great. Right? My own mental health is far more valuable than fighting with the person about the parking spot or the garbage can or whatever it might be. Number 2, compromise whenever possible. Just let it go. Number 3, avoid conflict. Number 4, escape if you see that there's a circumstance where there's just too much pressure and too much stress. Try to avoid those types of circumstances. Don't sit with people that fight. Don't meet with people that argue. When you see 2 people arguing, move away from the argument. Unless you're the rare person that has the ability to break it up, move away from the argument. But let me just summarize this whole point in one simple statement. The Prophet ﷺ, he guaranteed a house in Jannah, a house on the outskirts of Jannah. I'll be specific because this hadith has 3 circumstances. I'm introducing it. The Prophet ﷺ guaranteed a hadith on the outskirts of Jannah for the one who gives up arguing even when they're right. The Prophet ﷺ guaranteed a house on the outskirts of Jannah for the one who gives up arguing even if they're right. So what does that mean? Every time my relative wants to argue with me, forget about it. You think I'm going to trade a house to win some argument over some idea that none of us even really know what we're talking about? No, let it all go. The cost is too high. Never argue with anyone. It's not worth it. Everybody loses in an argument. Everybody loses. There is never a winner in an argument. All right? Even if you wanted to try to convince somebody, let's say you knew something was true and they're absolutely speaking falsehood. In an argument, the exchange, that no one ever gets convinced. The argument, everybody has their shield up. Everybody's ready to fight. You can't convince. Convincing comes with love, not with fight. So generally, avoid conflict. And that will also protect our own mental health, particularly at home. We should not be fighting with our spouses, fighting with our children. Figure out a way to keep love and peace and happiness in the home.
Yeah, that's great. And then, moving on to the action item number 8. So a healthy diet, again, part of how we can keep our mood elevated, keep ourselves happier. And remember, we talked about pushing the tide, turning it towards normalcy. So protective foods, these are basically foods that protect against injury to our neurons. These are, in our brain, there are structures that these foods can preserve them. So nuts, beans, lentil, dark green, leafy vegetables, these are healthy neuroprotective foods. Then we talk about diet high in omega-3s. This has been shown also to be protective for our mood. So fish, salmon, eggs, flaxseed, things like that. And then complex carbs over simple carbs, brown rice, starchy vegetables, and quinoa. Quinoa is a tough one, but you can try it, okay? but definitely these kind of foods are going to be more healthier for you in the long run. I think the grand scheme of things, we have to understand that, again, this is trying to be protective to maintain our mental health. So why not engage in some of these at least?
Yeah, so let me speak about these omega-3s because they're very important. So omega-3s are a type of fatty acid, EPA, type of fatty acid. And these omega-3s have been shown to have be very beneficial, particularly in cardiovascular health, but also in mental health. The idea here is that omega-3s, they decrease inflammation. And inflammation, when you decrease inflammation, you increase the conversion of amino acid to serotonin, so you can actually increase the amount of serotonin. Now, interestingly, I'm going to quote you one study. There's some studies that show that a gram, 100 milligrams of omega-3s in a day will actually give some people the same benefit as taking a SSRI, which is just a type of antidepressant. Now, I'm not giving you the medical advice. The physician has to give it. This right here is our physician in this particular instance. But I'm just saying to you that there are some studies that show even that much benefit for omega-3s. So, this notion where Jawad mentioned earlier, fish, eggs, flaxseed. I think in one tablespoon of flaxseed is 700 milligrams. So, like a tablespoon has a lot of flaxseed oil. Flaxseed oil has 700 milligrams. So anyway, omega-3s are highly beneficial, and they're shown to stabilize a person's mental health, stabilize them in circumstances of sadness, and even if a person's experiencing severe sadness, to help to alleviate some of that.
Okay, so moving on. So action number 9 is gratitude and presence. So what we're talking about here is taking a pause and reflecting, right? Taking a pause and reflecting and being present, okay? So for example, when we're eating, right, we should be appreciating the texture, the smells, the way the morsels of food feel, the taste, the way it satiates us, right? And being able to say subhanAllah for each subsequent bite's flavor profile. Think about that. If we're doing that, studies have shown that when we're present in the moment, we're not able to be somewhere else. So what happens? When we're eating, we're thinking about what did we do wrong last week? Or what's coming up next week? What deadline I have to meet by next week? Who did I get into an argument with last week? So we're not in the present. We're either behind or in the future. So studies have shown that when you stay in the present, because what is anxiety? Anxiety is the mind racing to the future or reminiscing about the past. So if we stay in the present, this can curtail our anxiety, curtail our depression. And so one example that we say, pause and reflect while you're eating. Another example is when you pause and reflect just to be grateful, right? So take a pause, like, and actively put that into your, we talked about goals. Maybe put that into your task list tonight. I'm going to do a pause to be grateful to Allah subhanahu wa ta'ala, right? The fact that 1 million neural processes are occurring to allow me to see and taste, right? Or the fact that, the sun's rays traveled 93 million miles to get to me and to warm me, right? Or the fact that Allah subhanahu wa ta'ala created such complex memory systems in my brain to be able to give me the ability just to remember my name, subhanAllah, right? So, or maybe the fact that Allah subhanahu wa ta'ala has fashioned our cortex to be able to experience emotions like happiness and sadness and excitement, subhanAllah. So studies have shown that when we're present and when we're grateful at regular intervals, that this definitely leads to an increase in mood. Obviously, this is highlighted by the Sunnah as well. Last thing here mentioned is a gratitude journal. I recommend this to a lot of my patients. once a week to sit down and just jot things down that you're grateful for, you'll see by the end of the year that list will be gigantic, inshallah, right? So that's pretty much all I wanted to add here.
So I think regarding gratitude and presence, we have this embedded in our deen. All you have to do is learn 10 daily du'as. Pick any 10 you want. When you wake up, oh, I'm waking up. Let me appreciate that I'm waking up. Let me recognize the gift of waking up, and you make the dua of waking up. When you enter the masjid, wow, Allah subhanahu wa ta'ala blessed me out of all of humanity to actually walk into the doors of his house. What an amazing blessing. And then I recite the dua. When I go out to work, I recite a dua. These few nodal points, what these do is by connecting these, let's pick 10 items, pick 5, don't even worry about 10, pick 5 in a day. Eating, entering the masjid, leaving home, starting the car, whatever. What these do is these become little energetic nodal points. And the nodal points allow for this flow, again, this flow of happiness that we've talked about throughout this lecture, this flow of happiness to spread from node to node to node so that it becomes continuous. So even though we would only pause and make dua a few times during the day, the benefits are continuous throughout the day. They increase the presence of a person vis-a-vis, particularly in the fact that they're the blessings that Allah has bestowed upon them. All right, action item number 10, by the way, there's 3 more slides. So action item number 10 is decluttering. So essentially what we mean by decluttering is that we should try to remove the number of items that are present in our immediate surroundings. Try to remove the number of items that are present in our immediate surrounding. This has been shown to increase many benefits, has been shown to provide many benefits, the greatest of which actually is mood. It's interesting, if you look at the chart of the pie chart of what are the benefits of decluttering, the biggest portion of that pie chart goes to mood. Now why? Because if I wake up every morning and I have hundreds and hundreds of things laying around all over and everything is disorganized, I automatically wake up to failure. I automatically wake up to chaos. And it makes life, it feels like a burden instead of a blessing. And I think most of us in this, unfortunately, we live in a time and place where we just can get so many things and keep bringing them and collecting them that we quickly lose the ability to organize things. So generally speaking, decluttering, which means to just get rid of what we don't need, give it away, sell it, slowly every day, spend a little bit of time rearranging and being particular about what new things we bring in to our lives and our homes. It actually is going to be far more valuable than having a lot of things. Now, it's human nature to think, let me just keep everything. But I'll tell you that we're so fortunate we don't have to do that. We don't live in a time and a place. You can literally go to the store and get anything you need anytime. It's much cheaper to get rid of the thing that you barely use and go and rent it or borrow it from someone or buy it again and donate it as soon as you're done with it than it is to store it, keep it, and have to let it weigh you down. So all of us should really pay particular emphasis to decluttering. And I would say declutter our physical lives by reducing the number of things that we have, particularly when we don't use them regularly. Like if I haven't touched this thing for a month, I don't need it for the next month or 2 months. Or if I haven't touched this thing for this season, then I don't need it for that season. And similarly, declutter in our own routines. What are the things that I'm bringing into my life? How much time am I spending online? What are the relationships that I have with people? Let me have 20 very close relationships, then try to be the friend of every single person. How many people have befriended me? I have 10,000 friends on Facebook. Those aren't friends. Those are just avatars. Friends are the people that you talk to, that you can connect with, and we only can have a handful of friends in life. We can have a lot of acquaintances, but you can only have a handful of friends in life. So this is action item number 10, which is to declutter.
Okay, and I was just going to say that Shaykh Husain, Amazon doesn't help us declutter nowadays. So.
Well, actually, I don't have time to discuss this because we're over time.
Maybe a separate lecture.
There's a study that shows that the people in general have up to 30,000 items in their home. Yeah. I don't know. I never counted, but 30,000 items in an average home.
Maybe we need a separate lecture on the Amazon disorder.
Right.
So seeking assistance. So this is the last action item. So now look, you've tried all these different action items. You're working with people close to you. You're monitoring yourself, and you're seeing that things are progressing. Maybe you're headed this direction, right, towards the side of more sadness and more closer to depression. So this is where you might seek assistance. And so this is pretty straightforward. Work and school resources. There's employee assistance programs at work. From high school all the way up to college, or middle school all the way up to college, there's going to be counselors at school. You can resort to them. The primary care physician is a good place to start if you're feeling overwhelmed. right? If you're like, I don't know where to go, most of us have a primary care doctor, just go to them. They're trained to at least hear you, right? If they don't feel that they can handle, they'll refer you out to a specialist. That's fine. But that's a nice place to start, okay? Then you have counselors, therapists. Again, counselors, therapists might serve a different need. You might have some self-esteem issues, some trauma issues. You might have some other issues you're dealing with, like relationship issues, so you might go to a therapist. But these are all available to us. Now, one caveat here I'll mention, that yes, if you prefer a Muslim therapist, there are options in the community, but they're limited, right? We all know that. So when you have a need, you need to find the resource quickly. So don't necessarily limit yourself to a Muslim psychiatrist or Muslim therapist or a Muslim counselor. One more thing I'll say, treatment works. Okay, alhamdulillah, right? Treatment works. 8 out of 10 people who were treated for depression showed improvement in symptoms within 4 to 6 weeks. This is with medication, okay? But despite the high treatment success rate, only 1 out of 3 individuals seek any treatment or receive any treatment, okay? So despite the high treatment rate, we are still not seeking treatment due to stigma, whether due to lack of awareness, and things like programs like today are trying to get that awareness out, or inability to know how to access resources. So I think, Shaykh Husain, you want to add anything else to that?
Yeah, I mean, I would just say 2 things here. Number one is that it's part of our deen to seek assistance. Right. It's part of our deen to seek assistance. When we don't know something, we ask our scholars. When we feel something that's off, we need to go and seek assistance. Allah has provided these resources for us, and there's nothing wrong with I don't know, and there's nothing wrong with I don't feel the way I think I should be feeling. So we should seek these resources, and they're available to us, and they are present all around us. So we should never feel like I don't have a place where I can turn. There are always places to turn, and there's many resources available, and it doesn't even necessarily have to be Muslim. I know that we prefer Muslims in some circumstances, but in this circumstance, given the prevalence and given the limited resources that our community has to offer, right, take advantage of the Muslim resources if you would like to, and I encourage them, and they're wonderful, excellent, but don't feel like now I can't get an appointment for 6 months, so I have no other place to turn. What am I going to do? Take advantage of other resources, whatever is available to you. Inshallah, they will be able to get you to where you need to be. By the way, part of life is just to know when I need help and then to seek it, and Allah subhanahu wa ta'ala puts barakah in that. So Allah is the only one that heals, by the way, right? The point here isn't that the resource is going to heal us. It's Allah is going to heal us. But how do we achieve that healing? It's by exhibiting the need towards Allah subhanahu wa ta'ala to take advantage of the resources that are present before us. And the only other point that I want to make here is that many times it's very common, particularly from the spiritual dimension, it's very common for people to come to me when they're feeling off or when somebody in their family is feeling off and to say, I know why this is happening. It's because there's somebody that's reading something against me, or there's the evil eye upon me, or there's some other force outside of me that's causing this upon me. So let me just start by addressing this in 2 ways. Number one, it's possible. It's theoretically possible that an evil eye could cause such a thing, that an evil force could cause such a thing, but it's not common. Certainly not as common as the number of people who come and tell me that that's what's happening. It's a small percentage of cases where that actually is truly the circumstance. And number 2, even when that circumstance exists, the Prophet ﷺ, for example, told us that the evil eye is true, correct? Everybody knows that the evil eye is true. But keep reading in that hadith. What else did the Prophet ﷺ say at the end of that? To be careful about how we make our ghusl, to be careful about how we purify ourselves in the face of that. So we should always be confident that Allah subhanahu wa ta'ala has always provided a reprieve for a difficult situation. So, yes, could it be? It's theoretically possible. But am I going to hang all my eggs in that basket? Am I going to put all my eggs in that basket? No. So I tell people that they should do everything. Number one, the three things everybody should do. Number one, you should make dua. Always. Even when everything is perfect, we should be making dua, that Allah subhanahu wa ta'ala maintain that. Number 2, a person should always seek assistance when needed, to the extent that even medicine has cure if Allah subhanahu wa ta'ala puts it there. So we should never lose the opportunity to seek assistance. And number 3, we should maintain purity, because purity is the best way to fight the effects of outside evil forces. Purity is the best way to fight the effects of outside evil forces. So could it be? Yes, certainly. But am I going to like spend the rest of my life chasing down which aunt did this to me, et cetera, et cetera? No, that's not the goal. That's not the goal. That's not how the deen functions. And now I have to like sit and make a big list and say, could it be this person? Could it be this person? Could it be that's all suspicion. That's actually all haram. It's not part of our deen to go and make a whole list of people that I suspect and then go and interrogate everybody. Did you do this? And did you do this? And I think you might have been the one. That's not the way this deen works. So I would just put all that away. Yes, again, like I said, it's real, but there's also real mechanisms that we can employ that will allow us to be able to avoid that. So again, action item number 11, which probably is the most important, is to always be willing to seek assistance in anything, by the way, but in particular in this circumstance. All right, so with that, we're going to close the session. The first thing I should probably do is just apologize to the local community for having to wait the extra 15 minutes for us to get through these slides. We built up some momentum. I didn't want to stop in the middle. And we have a specialist here. We don't often get that opportunity. So I just thought it would be worth spending the extra time. So I apologize to anyone who had to wait the additional 15 minutes for the Isha Salah. And then finally, I just wanted to spend a moment to thank Jawad, Dr. Jawad, for coming. SubhanAllah, to achieve the degree of training that he has, and then to bring that expertise and share it with us, and to share it with us with a love and concern that actually is what, like a parent would come for their own child. You don't find that, commonly. So it's a big blessing upon us to have somebody take their time and actually come here with just the only expectation is a reward from Allah and betterment of the ummah of the Prophet ﷺ. So it's an honor and pleasure to be able to have him here. And on behalf of myself and everybody here, and we have hundreds and hundreds of people all over the world listening. I just thank Dr. Jawad and his family for taking the time out. And then finally, I just wanted to thank everybody who attended, wherever you might be. When a bunch of hearts come together for the sake of Allah and wanting to improve ourselves in order to be able to better serve our Lord and be able to better strengthen our community, then that is a very, very powerful thing. And, for all of you to come, that's what makes the gathering the gathering. So may Allah subhanahu wa ta'ala bless all of you for taking the time out of your busy schedules to be here. May He grant you beyond what your expectations were in coming here. May Allah subhanahu wa ta'ala keep all of you healthy and happy in this life and the next. And may He extend that to all of your family, friends, and loved ones. If anybody in this room is facing any difficulty associated with what we've discussed today, may Allah subhanahu wa ta'ala make their coming here a means of achieving a cure for their circumstance. May Allah subhanahu wa ta'ala strengthen every member of this community and allow us to be amongst those who use that strength to be able to serve Him in a way that will please Him and will allow us to attain His pleasure in both this life and the next. Wa akhiru da'wana anil hamdulillahi rabbil alameen.